Dentist. The only person in the whole wide world that brings terror to the heart of even the toughest son of a gun. See? Dentist humor. The more casual we are, the scarier it gets. But today, I will not bore you to death. I tell you a terrific story of dentistry, from beliefs in toothworms wiggling in your molars, through pulling out teeth by barbers, yes, barbers, to using high-tech materials, but first... For thousands of years, people blamed goats and toothworms living inside their teeth for the excruciating pain in their mouth. The logic was simple: if there's a hole, there must be a worm that did it, like in a wooden plank. Those toothworms were supposed to live in your teeth, hiding from you under the surface of the attacked tooth. When it was consuming a tooth, the person suffered from toothache. When the worm was stuffed, the pain weakened. The superstitious belief in a toothworm was found from the Babylonian cuneiform tablet titled The Legend of the Worm, where the worm was to drink blood and consume the roots of the victim's teeth, through Central American legends of Popol Vuh and Mayan dentistry, through Europe's Homeric hymns, and even in the 14th century AD French surgeon Guy de Chauliac, who still believed in those creatures. Until 4 centuries later, when in the 18th century his fellow countryman Pierre Fauchard finally dispelled this fairy tale using a microscope. Was it the end? Not exactly. In 2009, the University of Maryland, Baltimore used microimaging on a dissected molar and revealed there worm-like structures, dentin tubules that look like worms. But they are just tiny structures causing people to react to cold or hot, especially when exposed. But let's indulge ourselves. What were the remedies against this wiggly creature? Magic, witchcraft, fumigation with toxic henbane seeds, even honey bait, to lure this worm to exit the tooth and snatch it while it was consuming the sweet bait. But among all those pointless methods, a few were quite on point, like using herbs and pain relievers or pulling out the infected tooth. Of course, today we know it's not the toothworm that causes tooth decay, but it's dental plaque bacteria. Nevertheless, strong roots for modern-day dentistry were slowly setting. The first known proof of dentistry practices in Europe is dated to be 14,000 years old and comes from today's Italy. It is in a form of an infected tooth roughly cleaned by means of flint tools. However, a 2017 study indicates that Neanderthals also used primitive dentistry tools even 130,000 years ago. On other continents, the earliest evidence of dentistry was found at the Mehrgarh Neolithic site in Pakistan, where drill teeth and flint drills heads dating from circa 7,000 to 5,500 years BC were discovered. Since no signs of fillings were found there, it is suggested that those bow drills were used to get rid of tooth decay. Such drillings perhaps evolved from decorative drilling. The earliest tooth filling, dating 4,500 years BC, was made of beeswax and was discovered in today's Slovenia.
Hello?
2,700 years before Christ, Chinese applied acupuncture along with burning special leaves on particular body parts close to the aching tooth in order to relieve the pain. 2600 BC in Egypt, there lived a scribe named Hesira, who is known as the first dentist in the world's history whose name survived to this day. He was humbly referred to as the greatest of those who deal with teeth and of physicians. Those are some big sandals to fill. Dental treatment techniques can also be found in Egyptian scrolls from the 17th and 16th century BC, like Edwin Smith papyrus or Eber's papyrus. The famous "an eye for an eye and tooth for a tooth" comes from the Babylonian Code of Hammurabi from the 18th century BC, where extracting a tooth was a form of official punishment. But it was 500 BC, again in today's Italy, when the Etruscans brought back humans a full-suit smile, because they were the forefathers of restorative dentistry. Dental bridges and partial dentures made of gold were found in their tombs. At about the same time, the Phoenicians, in modern Lebanon, used gold wire to stabilize loose teeth. Ancient Greeks like Hippocrates and Aristotle wrote about decayed teeth, wires for stabilizing teeth, or teeth extraction. After Romans conquered Etruscans, they incorporated dental practices of the conquered tribe. For example, in 100 BC, Cornelius Celsus, a Roman medical scholar, wrote extensively on treating teeth-related diseases and oral hygiene. Amalgam fillings, so common not so long ago, but what if I told you that the first documented amalgam fillings, a mixture of mercury and other metal, are more than 1300 years old? Described by the Chinese physician Su Kung in 659 AD, who wrote about silver paste as a dentistry filling. Very innovative and educated Arabic physicians of that time like Avicenna or Abu al-Qasim wrote mainly about the importance of oral hygiene and cleaning teeth because Quran, the sacred scripture of Islam, was against mutilating the body, as the dental medicine of that time was perceived. Herbs and other medicines were applied. Extractions were a rarity. The decayed tooth mostly fell on its own. In Europe, after the fall of the Roman Empire, the development of medicine as such halted for almost a millennium. The main places where the people suffering from a toothache could get help were Catholic monasteries. Monks were the most educated people of that time, therefore many of them practiced medicine, including dentistry and surgery. However, like in the case with Muslims, in 1163 a church council in France banned monks from practicing the mentioned surgeries and dental procedures as those involved the shedding of blood, which was in conflict with the high moral positions of the clergy. Thanks to the church, European medicine did a huge step back into the Dark Ages. After that, the only people who had any, even if second-hand knowledge about surgeries and dental medicine were barbers, from Latin barba, a beard. Barbers were the guys who had previously only assisted the monks in their medical procedures, shaving their beards and heads, as well as sharpening blades for the mentioned surgeries. Now those men were to take over. They started calling themselves barber surgeons. Side note, the word surgeon comes from the Greek chirurgos, meaning done by hand. Barbers, apart from shaving, cutting hair, also dabbled in bloodletting and most often in tooth extraction. Barbers used to hang pulled-out teeth on display as an advertisement for their services. The most common tool for conducting this painful procedure was a simple string or blacksmith pincers. However, in the 14th century, the already mentioned toothworm believer Frenchman Guy de Chauliac invented the dental pelican, named after its looks, a tooth extractor which was used for 4 centuries until it was replaced by the dental key, which was finally, about the 20th century, replaced by less complex looking but very precise modern dental forceps. France seemed to be the home of modern dentistry. In 1210, a guild of barbers is established there. But 200 years later, a series of French royal decrees will ban lay barbers from practicing all medical procedures except bloodletting and extracting teeth. After all, that was actually a good decision in a long run of medicine, because barbers had to split into 2 groups: one, surgeons conducting more complex procedures, and the other barbers, or as they like to be sometimes called, barber surgeons, who put leeches, shaved your head and extracted your teeth. Now you know why barbers and dentists have so similar armchair seats. Dark Ages wouldn't be dark if there wasn't a brutally slain saint to give people hope, relief, and whose relics could be profitably sold. Saint Apollonia is exactly that, the patron saint of dentistry to whom tooth-aching people still can call for help. Saint Apollonia was a virgin martyr from Alexandria, that's in Egypt, who in the 3rd century AD had all her teeth brutally pulled out or shattered due to persecution of Christians by the Roman Emperor Decius. She is often depicted holding pincers with a tooth in them. During the Middle Ages, many teeth claimed to be hers were sold as toothache cures. Until 1530, the world had no known book entirely focused on dentistry. It was the German Michael Blum's Little Medicinal Book for All Kinds of Diseases and Infirmities of the Teeth, addressed to barbers, and contrary to other medical texts of the time, it was not written in Latin but in the mentioned German. That also shows that still dentistry was considered the lesser of the medical arts. The book contains the world's first printed illustration of a tooth extraction. In 1575, French father of surgery Ambroise Paré published his written in French complete works with practical info on dentistry. Tartar bacteria was identified in 1683 under a microscope by Antony van Leeuwenhoek, a Dutch scientist and the father of microbiology. 2 years later, in 1685, Englishman Charles Allen from England published The Operator for the Teeth, also in his native language, making it the first dentistry book in English. At that time, barbers taking care of teeth were kinda divided into two sub-professions. One was a tooth drawer, which is self-explanatory. The other was the mentioned operator for the teeth, who used a wider range of techniques. Dentist, that word for describing tooth operators in England, came to use in the mid-18th century from the French word dentiste, which along with Latin means tooth. This short term immediately indicated what is what. Only the rich could afford the services of the operators for the teeth or the dentistes. The rest of hoi polloi had to book visits with local blacksmiths or tooth drawers. On local fairs, more often one could find strange concoctions and tinctures advertised by sellers as tooth care cosmetics. The upper class could afford to have dentures. Those were mostly made from walrus, hippopotamus or elephant ivory. Human teeth were also quite common as a merchandise in that matter. Many of those were sometimes called Waterloo teeth, as a reference to the battlefields or graveyards where they were harvested from. In 1789, Frenchman Nicolas Dubois de Chemin got the first patent for making porcelain teeth, but porcelain dentures introduced in 1790s still were prone to crack and looked strangely bright, since white teeth were a rarity at that time. Crowns, dentures or root canals gained popularity by the mid-1700s. During that time, Frenchman Pierre Fauchard developed dentistry into science we know today as distinct profession, hence he is called the father of modern dentistry. In 1728, he published The Surgeon Dentist, or Treatise on the Teeth, printed in French, thoroughly describing the methods for treating dental diseases as well as producing dentures. He also described that tooth decay is not from some toothworm but from acids coming from sugar, like tartaric acids. Thanks to him, the study of dentistry expanded very quickly. Dentistry in the US started with the barber surgeons who arrived in 1630s from England to America together with the settlers of the Massachusetts Bay Colony. One of the first dentists in the US was Englishman John Baker, whose most famous patient was George Washington, to whom Baker made a set of ivory dentures. But the most famous American dentist of the time is Paul Revere, who made his midnight run to alert the colonial militia about the approaching British forces. Before he became a hero of the revolution, he was a dentist who studied with the mentioned John Baker. Revere advertised his services as a dentist and also made dentures. Moreover, he is the first person to identify a body by the teeth, the first to conduct what is called dental forensics. In 1776, He identified a body of his friend from the mass grave, recognizing the dentures he had made for him. In 1771, English surgeon John Hunter, the father of modern surgery, publishes The Natural History of the Human Teeth, with detailed anatomy of those. He is also the first to attempt to transplant human tissue from one person to another, using, yes, you guessed it, teeth. It proved to be unsuccessful. Well, even today, we normally don't transplant teeth, especially between two different people, due to many risks. In 1780, Englishman William Addis makes the first modern toothbrush. Do you want to hear the fascinating story of the toothbrush? Coming soon. In 1790, another of George Washington's dentists, John Greenwood, takes apart his mother's foot treadle and uses it to propel the drill, making the first known dental foot engine. His father, Isaac Greenwood, was the first dentist born in the US. The same year, Josiah Flagg, also American dentist, constructs the first chair for dental patients. Let's talk about George Washington and his wooden teeth. The first American president's teeth problems began in his early 20s. By the time of his presidential inauguration in 1789, he had only one natural tooth remaining, which 7 years later will be pulled out by his dentist, Dr. John Greenwood, who kept it as a souvenir in a glass container attached to his watch chain. Greenwood also made Washington his first full set of dentures. Hence, perhaps the myth and misconception about George Washington having wooden teeth. Green wood teeth became wood teeth. Of course, Washington didn't have wooden teeth in his mouth, but what may be more disturbing, apart from dentures made from ivory and various alloys, he had teeth of African slaves. There is a page from Washington's ledger that describes the purchase of 9 teeth from African slaves. Although Washington had numerous dentures, many of them didn't sit well in his mouth, what he complained about in the letters to his dentist. The dentures altered his face shape, what can be seen in a famous portrait of him from 1796 by Gilbert Stuart, where the president's face is puffy and swollen. First Lady Martha Washington also wore dentures. At the very beginning of the 19th century, after Nicolas Dubois de Chaumont's patent expired, another dentist by the name of Giuseppe Angelo Fonzi from Italy took a more successful approach to porcelain teeth dentures, making them more and more popular. It wasn't until nearly the end of the 19th century that dentistry evolved from a trade to profession. The difference is, in the first case, you didn't have to have any qualification. Now you had to have it. In 1825, Samuel Stockton White, a good name for a guy who begins manufacture of porcelain teeth in the USA, with his company dominated the dental supply market there for the rest of the century. In 1839, the vulcanization process for hardening rubber is invented by Charles Goodyear. You may ask, what a car tire has to do with your mouth? This cheap material called vulcanite, vulcanized rubber, perfectly molded to the mouth, so it was a great base for porcelain teeth. Soon, vulcanite started a new era of mass-produced and affordable dentures. In 1840, the Baltimore College of Dental Surgery becomes the first dentistry school in the world. It is today's School of Dentistry at the University of Maryland. 1844. Finally, somebody thinking about the patient's comfort. American dentist Horace Wells discovers that nitrous oxide has anesthetic qualities. He used this anesthesia in his private practice, and a year later, he demonstrated it to the public. However, the demonstration failed. The patient was screaming during the procedure, but in 1846, Wells' student William Thomas Green Morton succeeded to conduct medical procedure during the public demonstration. Instead of nitrous oxide, he used ether. And until 1870, it was disputable who invented anesthesia, Wells or his student. Despite the fact that the patient cried during the procedure, it is Wells who is considered the one who invented anesthesia. Is it fair? In my puppet opinion, yes. Ether proved to be too dangerous as an anesthesia, whereas nitrous oxide is still widely used. What about women in dentistry? In 1814, Josephine Serre becomes the first woman to earn a degree in dentistry from the University of Tartu, Estonia. And in 1866, American Lucy Hobbs Taylor becomes the first woman to graduate from a dental college, the Ohio College of Dental Surgery. And in 1890, Ida Gray will become the first African-American woman with a dental degree, graduating from the University of Michigan School of Dentistry. Robert Tanner Freeman is the first Afro-American dentist. He graduated from Harvard University Dental School in 1869. In the 1880s, collapsible metal tube as a toothpaste container was finally invented. The person who makes the best use of this invention is Washington Wentworth Sheffield, a dentist from Connecticut, who is said to be the first in the US to popularize tube toothpaste. Earlier, dentifrice was available only as a liquid or powder prepared by individual dentists. It was sold in bottles or ceramic pots. The toothbrush was just dipped into the pot. Its powdered form used to be sold in paper boxes. In 1890, an American dentist in Germany, Wilhelm D. Miller, published The Microorganisms of the Human Mouth, in which he presented a theory that tooth decay was the result of bacterial activity. Due to this publication, oral hygiene became the center of interest, and regular toothbrushing and flossing were encouraged. In 1895, a German physicist, Wilhelm Rengen, discovers the X-ray. A year later, in 1896, Charles Edmund Kells, a dentist from New Orleans, takes the first dental X-ray of a living person in the US. The beginning of the 20th century starts with another relief for the toothacheing patients. In 1905, a German chemist, Alfred Einhorn, developed Procaine, a local anesthetic known today as Novocaine. A shot of this and drill all you want, while patient is wide awake. In 1907, American dentist William Taggart invented a casting machine which helped dentists make precision cast fillings. In 1913, American dentist Edwin J. Greenfield created the first modern dental implant, starting the era of today's advanced implant and aesthetic dentistry. The 1930s is the time when an American dentist, Frederick Mackay, discovers that in the places where drinking water is naturally abundant in fluoride, people have low dental caries but more mottled enamel in teeth. Nevertheless, the year 1945 marks the beginning of mass fluoridation of drinking water in the USA. That indeed led to a significant drop in tooth decay, and the first fluoride toothpaste is introduced in the 1950s. The year 1957 will forever change the sound and speed of dentistry. American dentist John Borden patented Aerotor, high-speed air-driven drill. Now drilling in order to prepare a tooth for filling was fast, simple and more precise. The 1960s, apart from putting men on the moon, put lasers in dentistry. They were developed in order to treat gum disease. Around the same time, light-curing fillings made of composite resin, the modern fillings, were also introduced. The beginning of the 1990s is the time of aesthetics in dentistry, introduction of home whitening products as well as veneers and implants. And the last info. In 2018, the European Union prohibited the use of amalgam fillings in treatment of children under 15 years old, as well as pregnant or breastfeeding women. So, as you see, dear patients, we had a very long way from agonizing pain of barbaric procedures and torture tools to painless extractions of wisdom teeth. And by the way, children love to make videos of themselves while being under influence of nitrous oxide.
Yeah, that's what I'm talking about.
Remember to floss and subscribe. Until the next time, patience!